Hi everyone, my name is Stephanie Bach, and today I'll be presenting on how HIV-positive parents can transmit the HIV virus to their children and how it can affect their everyday lives. To begin, it is important to understand what the term HIV actually means. The human immunodeficiency virus is a retrovirus that suppresses the body's immune system. The HIV virus makes copies of itself as it destroys white blood cells, which gradually breaks down a person's immune system. HIV is found within an individual's blood, semen, vaginal fluid, and breast milk, making the risk factors and transmission of HIV common among male to female sexual contact, exposure to contaminated blood products, and perinatal transmission from mother to infant, either during pregnancy, delivery, or through her breast milk. An HIV-positive mother has a 30 to 45% chance of transmitting the virus to her child. During pregnancy, the fetus can be infected with HIV as it crosses through the placenta. During childbirth, the baby is infected by HIV in the mother's cervical secretions or blood, as well as during breastfeeding, as the baby would become infected with HIV in the mother's breast milk. Predisposing factors which increase the likelihood of transmitting HIV to a child include a premature delivery, frequent unprotected sex with multiple partners during pregnancy, prolonged or difficult birth, cervical or vaginal infection, breastfeeding or mixed feeding, and children who had a low birth rate were seen to be twice as likely to be infected with the HIV virus. With low birth weights in mind, the country which suffers the most from malnourished or underdeveloped and premature births is Africa. According to the WHO, of the estimated 39.4 million people living with HIV worldwide, more than 2/3 of them reside in Africa. In regards to Gabriel Relich's video, if there were only 100 people in the world, 15 would be in Africa, equating to 15% of the world's children having a high prevalence for obtaining the HIV infection from their mothers. In reality, it is estimated that 90% of the world's HIV-infected children live in African countries, and more than 500,000 die of HIV each year. Vulnerability is determined by a convergence of predisposing, enabling, and need characteristics to determine an individual's access to healthcare and influence their risk of contracting illness or recovering from an existing illness. Factors such as biological, behavioral, socioeconomic, cultural, and structural risks all increase a woman's vulnerability to HIV acquisition. Becoming vulnerable to an infectious disease is primarily based upon interactions between multiple factors, over which individuals have little to no control over. The culture and society in Africa consists of a dominant and patriarchal order, making women's health inferior and their health needs less than significant than that of their male counterparts. Additionally, in many African countries, young girls are expected to marry older men, making them much more vulnerable to HIV infection. Women who marry young are also less likely to receive less formal education and have less exposures to HIV prevention mechanisms. The following video discusses an organization, CARE, founded within Africa that ensures childbearing mothers are receiving adequate access to healthcare during their pregnancy.
CARE is part of a global coalition pushing to advance women's social status and access to essential healthcare before, during, and after childbirth. CARE works to ensure safe motherhood is recognized as a fundamental right and that the commitments governments make to improve maternal health are delivered.
However, to prevent mothers from obtaining HIV initially, it is important that they are receiving a well-rounded education regarding the potential risk factors that the HIV infection can bring about. The absence of an informal education regarding HIV prevention mechanisms seen across Africa has led to a slow progression of avoidance tactics focused on the transmission of HIV from mother to child. The most common prevention mechanism of the HIV infection is avoiding the transmission to the mother in the first place. By doing so, HIV prevention programs can direct their attention to a range of women at risk to avoid transmission to their child. If a woman who is HIV positive becomes pregnant, they should be presented with the option to have an elective C-section to help reduce the risk of transmission through the birth canal. Additionally, women who are known to be infected with HIV should be receiving the essential care and support services with regards to family planning and their future reproductive decisions. Regardless of the large number of children living with HIV, that number has almost halved since 2010, with a 47% reduction in any new HIV cases. This decline is in large part due to the delivery of antiretroviral medicines to women who are living with HIV during their pregnancy and while they breastfeed. However, about 24% of pregnant women living with HIV do not even have access to this drug to prevent the transmission of this disease to their children. Average cost of the antiretroviral therapy is at least $15,000 per year, making such treatment difficult for many patients and keeping it out of reach in developing countries where more than 90% of the new HIV infections occur. Halting the progression of the HIV virus in women specifically can result in a dramatic decline in the number of cases of children living with HIV, especially in the underdeveloped countries. After watching this presentation, I would like to leave you with some thought-provoking questions regarding HIV acquisition throughout Africa. I would like to know, how do you think the antiretroviral drugs can be made available to everyone equally, regardless of economic position? Secondly, what are some of the benefits of HIV awareness education, and do you think this awareness is headed in a positive or negative direction, and why?